them to acquire the skills needed to actively contribute to national development. She encouraged them to align themselves with the government of Burundi Vision 2040-2060, which aspires to transform the country into an emerging and developed nation. Her remarks were made during the ceremony for the announcement of third-term results.
City of Burundi, Gitega, the province of Buhumuza, will be led by Denise Ndaruhekere, the former chief of staff of the governor of Muyinga province. Major General Aloys Ndayikengurukije will lead the province of Bujumbura, having previously served as administrative director general of Sosumo, a sugar company. The province of Burunga will be led by Parfait Mbonenyibuka, currently honorable deputy. The province of Butanyerera will be led by Police Brigadier General Victor Segasago, who is previously serving as governor of Kirundo province. Finally, the province of Gitega will be led by Riboire Bigirimana, currently working at the Ministry of Education. The Minister of Home Affairs, Maritini Terese, who was sent by the head of the state to Senate after presenting resume of the new governors to the senators. They have adopted the nominations anonymously. The ambassador of Indonesia to Tanzania, who is also accredited to the region, including Burundi, handed a letter to Mr. Odas Ndayizeye extending his tenure of honorary counsel for the Republic of Indonesia and Burundi. Jivan Deshimie for more details in this report.
The ambassador of the Republic of Indonesia to Tanzania, who is also accredited to the region, including Burundi, handed a letter to the honorary counsel of the Republic of Indonesia in Burundi, Mr. Odas Ndayizeye, extending his tenure as honorary counsel at the conclusion of his first term. The Director General of Foreign Affairs welcomed the strong relations between Burundi and Indonesia and expressed the hope that they would be further strengthened. Ernest Nyokindi stated that Burundi has adopted ambitious vision to become an emerging country by 2040 and developed country by 2060. This vision outlines the priority areas where efforts will be concentrated to achieve these goals. He added that despite challenges, the determination of the Burundian people, supported by partners such as Indonesia, offers hope for a promising future. The Indonesia ambassador to Tanzania and the region expressed satisfaction with the quality of relations between Burundi and Indonesia and emphasized the desire to deepen cooperation, particularly in fields of education, mining, agriculture, livestock, and other areas of development.
The Ministry of Public Health and Fight Against AIDS commenced the actions called out by the emergency organization based in Egypt for treating children with the heart defects and other disabilities in collaboration with the Bossa Nocte organization. This statement was made on Wednesday by the Minister of Public Health, Dr. Lidwine Baradahana, during her visit to the Prince Louis Rwagasore Hospital in Bujumbura, where a screening campaign for these children was taking place. Reports.
These activities are carried out by the organization Emergency in collaboration with the Burundian organization Le Bon Samaritain, which supports children suffering from various illnesses, including heart disease and other conditions commonly present at birth. This initiative is being implemented at Prince Louis Rwagasore Hospital. Alexis Butoyi, president of Le Bon Samaritain, explained that they work with emergency based on well-defined procedures for the treatment of children with heart conditions requiring pediatric surgery. Luca Lola, Regional Program Director, expressed appreciation for the collaboration between Emergency and Burundi, emphasizing that many children have already benefited from this treatment.
We operated the majority of children, and we are doing the follow-up of children already operated in Entebbe, and we are screening new patients. Up to now we have operated 139 Burundian children in Entebbe, and considering that many children are affected by complex congenital disease, we need to operate 2-3 times. They need more surgeries. So we operated 139, but we transfer 200 children. This means that 1 out of 2, more or less, need at least 2 surgeries. And all these services are completely free of charge. The transport from Bujumbura to Entebbe, the accommodation of the family in our hospital, the food, the intervention, the drugs, everything is completely free of charge.
For her part, the Minister of Public Health and the Fight Against ADC, Dr. Ridwine Baradahana, stated that these children were previously treated in Sudan, but due to security concerns, operations are now being carried out in Entebbe, Uganda. She praised the ongoing efforts and noted that receiving care in Uganda has simplified the treatment process. When a child born with a disability, they may also suffer from other medical conditions, she added. The doctor therefore returned to conduct a follow-up visit and assess the recovery of those already treated. It is worth noting that emergency has already treated 139 children, of whom 116 have fully recovered, and that all care is provided free of charge, with the organization covering airfare to Entebbe and other essential needs.
Remaining the sector of health, the National Institute of Public Health, INSP in French acronym, organized a National Scientific Day this Thursday on molecular surveillance of pathogens and the One Health approach in Burundi. During discussions, scientists revealed that a new case of epidemic type malaria has been detected. Marius Muhigwe.
National conference, it was noted that at a time when health threats are increasingly complex, interconnected and cross-border, human health cannot be considered more closely in isolation. Recent pandemics have served as a stark reminder of how closely linked animal, human and environmental health are. This is precisely these scientists have been called upon to integrate into their disease surveillance and prevention strategies. According to the Director General of the National Institute of Public Health, Professor Joseph Nyandwi, Burundi has rich in biodiversity, but also in the fight against infectious and emerging diseases. The establishment of mechanisms is more than necessary. He said this approach would be essential in the surveillance of pathogens such as Plasmodium, the hemorrhagic fever virus, and many others. He also added that challenges are also there. He will let you know that that conference was an exceptional platform to share research results, and so at the national level to inspire the building of the national system of integrated preventive and resilience based on the science and the collaboration.
Before wrapping up our news broadcast, let's take you in international news. Israel Prime Minister Benjamin Netanyahu made his first visit to Gettysburg on his own Wednesday since the devastating October 7 attacks, marking a highly symbolic moment as the faces survivors and toward one of the hardest hit communities near the Gaza border. Have a look.
Let's start with Kibbutz Nir Oz, which is a special place. It has an important place in the history of the State of Israel. It was one of the outposts that fought for Israeli independence against the Egyptian army back in 1948. And the entire community, the entire commune, is defined as a botanic garden. It's an internationally renowned oasis, and especially with succulents and cactuses. So it's a very special place, special in many ways. The Prime Minister visited it today for the first time, entering through the back gate. This is a community that was completely ravaged on October 7th, 2023. It lost more than 1/4 of its inhabitants to murder and to kidnapping, and there have been a long series of complaints for almost 2 years now about why the Prime Minister has never come to visit. He came today. He slunk in through a side entrance in his armored vehicle. He was received, from what we hear, politely by those residents who agreed to meet him, but there were protests outside the front gate, and some of the residents, among them most famously, I think, Uma Kedem, a very renowned fashion designer in Israel, who lost her daughter, her son-in-law, her grandmother, her in-law, and her 3 grandchildren on October 7th were all murdered. She led a protest demanding that the Prime Minister not be allowed to step foot. The community is still completely wrecked, and we're still waiting. He just left. We're still waiting to hear any more news that will emanate from that visit.
Till here, we have no more. Thank you for being with us. Bye-bye.